So today's lecture topic is drugs for neurodegenerative diseases, and this is the list of the diseases we will discuss today. So it includes the anti-Parkinson drugs, anti-Alzheimer drugs, drugs for the treatment of the multiple sclerosis, and uh, that is it. And we will start with the Parkinson disease. The most important parts of the brain that are involved in the development of the Parkinson disease are striatum and substantia nigra. So these parts of the brain should interact with each other by inhibiting each other. And the substantia nigra normally inhibits the neurostriatum, and neurostriatum is normally inhibiting the substantia nigra. And these uh, parts will that will lead to the balance between the excitatory and inhibitory activity. However, with the Parkinson disease, there is an imbalance between this activity of these neurons. So the neurons that are inhibiting dopaminergic neurons of substantia nigra uh, is not inhibiting too much the neurostriatum by releasing dopamine. So there is a lack of the dopaminergic neurons in substantia nigra. And then there is a acetylcholine neuron that is activating the GABA neuron. So this then these GABA neurons back inhibit the substantia nigra. So this common inhibitory pathway. So when the dopaminergic neurons decrease and they no more inhibit the neurostriatum, that leads to the lack of the inhibition of the GABA, and that is leading to the imbalance between the system and development of the Parkinson disease. The symptoms may lead to the shaky hands and the uh, the walking movement disorders, and that usually decreases the mobility of the patient. Then let's discuss the drugs that can be used for the treatment. So, and the first drug that is commonly used is levodopa. Levodopa is a precursor for the dopamine, and once in the central nervous system, levodopa is converted to the dopamine and can increase the amount of the dopamine that is released from the dopaminergic neurons. That is the primary mechanism of action of the levodopa. However, levodopa is also converted to dopamine in the peripheral nervous system that leads to the adverse effect reactions. That is why most of the time levodopa is prescribed with the carbidopa that inhibits its metabolism in the peripheral nervous system. And carbidopa is non-permeable for the central nervous system, so that is why it only inhibits the metabolism of levodopa in the peripheral nervous system. Then we also have inhibitors of the catechol all-metal transferase, entacapone and tolcapone, that can further decrease the adverse effects of the levodopa and increase its activity because of the decreased metabolism. On the periphery, more levodopa can enter the central nervous system. So, also there are drugs that inhibit the uh, enzymes of monoamino oxidase, and these drugs are prazoligin and seliglin, and these drugs also increase the amount of dopamine in the synaptic cleft by inhibiting the enzymes that destroy the dopamine. That includes deox enzymes, monoamino oxidase B, and catechol or methyltransferase. So tolcapone is also can be uh, combined with these drugs to further increase the concentration of the dopamine in the synaptic cleft. So this is the first group of drugs that increase dopamine. Then second group of drugs are dopamine receptor agonists. These include bromkriptine, uh, apomorphine, ropinirole, rotigotine, and pramipixole. So these drugs will activate dopaminergic receptors or dopamine receptors directly. So this is the second. And then there is also edamame, uh, amantadine. Amantadine is also considered to increase the dopaminergic activity, but however the mechanism of action is unknown, and amantadine is a antiviral drug, has been developed as an antiviral drug, but for some reason increases the dopaminergic activity in the central nervous system as well. So these are drugs that increase dopaminergic activity, and the second way to treat the disease is to block the cholinergic activity in the central nervous system, and for this purpose we use benztropine, biperidone, uh, uh, procyclidine, and trihexyphenidyl. These drugs are central muscarinic blockers like atropine, but are more selective and can block the acetylcholine action in the central nervous system by blocking the muscarinic receptors. That decreases the tremor of the hands and the symptoms of the disease. So these are the drugs that are used for the treatment of the Parkinson's disease, and side effects include the depends on the drug group. So for the levodopa and carbidopa combination, we have nausea, vomiting, the decreased appetite, decrease in the blood pressure, depression, um, and uh, the urinary retention. Then seliglin and razoglin lead to the nausea as well, vomiting, the nightmares, the uh, weakness, and the hallucinations. Entacapone and tolcapone leads to the uh, constipation and liver toxicity. Then anticholinergic drugs will lead to the constipation as well, the dryness of the mouth, and the loss of the vision, and uh, can lead to the decreased activity of the uterus. Then bromkriptine, ropinirole, and pramipixole, nausea, vomiting as well, as the depression, the uh, feeling of tightness and throat, same for the rotigotine and apomorphine, so also low blood pressure. So these are the side effects of the drugs, and let's move to the next group of the drug is Alzheimer's disease and medicines for the treatment of Alzheimer's disease. And Alzheimer's disease is a relatively new uh, disease that has been recently developed drugs for the treatment, and there are three hypotheses in the development of the Alzheimer's disease. Neither of them is considered better than another. So the first hypothesis is decrease in the acetylcholine in the brain. So Alzheimer's disease is usually a neurodegenerative disease developed in the old people that leads to the completely loss of the memory. So first hypothesis is decrease in the acetylcholine in the brain. Second is beta amyloid hypothesis that leads to the development of the beta amyloid plaques. And the last is the tau hypothesis that uh, leads to the damage of the tau proteins and decrease in the speed of the uh, speed of uh, the neuron excitation that or a development because of the tangles in the neurofibers. So, and because for each of the hypotheses there are some drugs for the treatment. So cholinergic inhibitors are used uh, to decrease the cholinergic sorry cholinesterase inhibitors are used for to increase the acetylcholine in levels in the brain that include galantamine, rivastigmine that you studied previously, uh, the, and also dopamine are the inhibitors of the acetylcholine esterase, and also butyryl choline esterase. Both enzymes can be found in the central nervous system synaptic cleft to decrease the acetylcholine destruction after it releases from the vesicles to the synaptic cleft. So the adverse effects of these drugs include the nausea, vomiting, diarrhea, increased heart rate, and also the headache. So then our second hypothesis includes the NMDA receptor antagonist. One of them is memantine. These drugs will block the receptors for the NMDA receptors for the glutamate, and that will decrease uh, uh, the action of the glutamate release and decrease the development of the beta amyloid. So adverse effects include the diarrhea, the headache, and the nightmares. And for the uh, for the beta amyloid, the hypothesis is supposed to be because of the Oh, so the tubular hypothesis also um, is the drugs for this hypothesis are being developed at the moment, and they should destroy the uh, tangled microtubules that lead to the Alzheimer's disease. Uh, and stabilize the tau protein and lead to the development of the healthy microtubules. However, there are no drugs yet developed for these purposes, and most scientists is still searching for the drug. So, like the here we can also see the process of the development of the beta amyloid. So there are beta amyloid plaques that lead to the development of the Alzheimer's disease, uh, and that usually develops from the uh, amyloid protein that is precursor for the beta amyloid plaque. So that is for today, and thank you for attending, and see you next week. Bye.